Hello and welcome back to the Physio Foundation's podcast for another week. This week I'm talking to Zuzana, and that's Zuzana Periton, about her recent experience working as a physio up in the ski fields of Falls Creek in Victoria, Australia. And yes, Australia does have snow, so you're going to find out all about that in a minute. Welcome back to the Physio Foundation's podcast. This is a podcast about the knowledge and skills that form the foundation of expert clinical practice. And remember, this is a discussion aimed at health professionals and health professional students. So always seek the guidance of a qualified health professional with any questions you may have regarding your own health or a medical condition. So this week I'm joined by my good wife, Zuzana, sports physiotherapist, PhD candidate, the other half of Periton.physio. So Zuzana, thanks for joining us again.
Hello. Nice to be back.
It's been a few weeks now, so I've missed a few weeks of releasing episodes, and we've been really busy with project work and coordination of teaching at the university, and Zuzana's been busy as well. And Zuzana's been away. She's had a whole week up at Falls Creek, and I thought, what a perfect chance to reconvene with Physio Foundations and sort of share that story of what you did. So let's find out about it. So what happened? What did you do? Where have you been for the last week? And why'd you go up to Falls Creek skiing and working? And tell everyone what happened.
Well, I guess to start off with, I met Luke, my husband, the other
That's
half
me.
of his. Yeah.
Okay.
I met him skiing. So I learned to ski when I was a physio student. Went over to Colorado for a working visa. And just worked the ski fields, learned to ski, loved it so much, went back and did a couple of ski seasons and tried out to be a ski instructor and got that job. So the love of skiing began sort of when I was 21. I've been able to travel with the Australian Paralympic Ski team. I've been able to do locums for different ski-related clinics. So I've done a fair bit in skiing, and that's really important. I guess any sort of physio working in different sports is to have an idea of the actual sport itself. This time, where I worked in Colorado, it was very much a skier environment. Not a lot of snowboarders when I was up at Falls. So I was lucky enough. One of my good friends owns a clinic up there and was looking for a locum to fill in before the next physio came in and did a large stint. So I put my hand up. I was very lucky to go up and be able to ski and work and study for the week. But back to what I was saying is over at Falls Creek in Australia, there's sort of, I guess it was almost 50-50, the snowboarders and skiers. So I was very happy that I've done one day of snowboarding where I tried to snowboard. Unfortunately, it hadn't snowed a lot. And to learn to snowboard, they put you on this pommer, which I think was a big mistake. Yeah, for those that don't know what a pommer is, it's a stick with a sort of a disc on the end that you sort of put between your legs, takes you up the mountain or up a little bit of the mountain. And then you can ski or snowboard down. Pretty easy on skis. You just put it between your legs, up you go. But on a snowboard, because you're sort of on the side, if you tip one way, then you'll fall that way. If you tip the other way, you fall that way. So
And no one feels sorry for you either in the line. Everyone's waiting, come on, don't fall over. And then the snowboarder falls over and the lift stops. I think no one goes and helps you either. It's good.
And I think that's the entertainment for the lifty, that's.
Yeah. So I've worked as a lifty. I did 2 seasons with my brother in Colorado. And the first season, so Zuzana and I met, as Zuzana mentioned, in Colorado, USA, doing the working holiday make a visa thing. And I worked on a lift. Zuzana was driving Resort Express vans. There was the company, and you were working, and then you got a ski instructor qualification. So I guess this was all post-graduation, actually, a lot of this stuff. So you've got to register as an Australian physio. You've got to do exams to register as a physio in the States, but we've worked in the UK as well, haven't we? Travelled around with
and
physio.
skied there too. You can ski in Scotland, everyone.
We carried out a big bag of skis, thinking that we would do the working in the UK thing, and then travel across and do lots of the winter in the Alps and ski France and everything else. And we ended up just getting really hooked on local mountaineering and climbing mountains in Scotland, and climbed as many of them as we could, and just found that was really fun. And it ended up just carrying the skis around for the best part of a year to all these different places. And then we skied for one day on spring ski. It was probably the last day this season at Glencoe, wasn't it? It's mostly rock.
It was. But we had a good time. Had a good time.
You can do a lot with your life with a health profession degree, a physio degree, or other health professional. You can get around, and especially a doctor, for example, you can travel around and do things. So let's talk about that. So let's not just talk about the physiotherapy work that you did. Obviously, it's a life passion of yours to ski, and me as well, and do sort of working holidays and adventures and try to thread that into your life. When you worked up there, you worked as a physio, you worked in a clinic, you obviously saw lots of people with acute injuries and lots of ACLs and other injuries. What other stuff do you do apart from the physiotherapy treatment when you're working with the ski team, for example, or even last week when you're working up at Falls Creek? What extra stuff do you do that perhaps a new grad physio may not have thought of yet?
Look, as an experienced physio, the thing that I am really appreciative of is the experience, but the people that I've met and their experiences. So, for example, I work, doing a PhD full time, and I work in a sports clinic one day a week, but you don't get the fresh ACLs coming into that particular clinic. And that was the biggest difference here was in this week, the amount of braces that I had to fit for ACLs, and understanding, where the research has gone. And it was really, really nice to be able to talk to people like Jane Rooney and Simon Roos, and the previous physio, Spencer Jackman, that was there. And it's getting the opinions of orthopedic surgeons as well. So they've all had these discussions of what's the best way to manage these ACLs. And the other thing is understanding the difference. We might just think, oh, okay, ACL, you might think of that unhappy triad when we're learning about it. So that, the ACL, the medial meniscus, and the medial collateral ligament. I think with skiing, the biggest thing that you've got there as well is the traumatic side. So really, a ski can get caught, or just like I was talking about before, understanding, snowboarding. So I always thought that snowboarding, skiing, you got your skier's thumb and you've got your knee injuries. So this is in the beginning. And then the snowboarders, because their feet are locked in, it's more about the wrists and the shoulders, the shoulder dislocations and things like that. But you forget that they take one foot off when they're getting on and off the lift. And that's where they're very, they're most vulnerable. And one of the patients that I had, which unfortunately did become an ACL, was she was on the lift on her own, thinking, great. And then two skiers came on, and so she really went to the one side of her bit of the lift, thinking, I want to get away from the skier, because she was a little bit nervous getting off. So she's got one leg in the snowboard, and then there's one leg that you use to sort of push off and glide off the chairlift. And unfortunately, she put her spare foot on top of the other person's ski as they'd sort of shuffled across. So when they came off, he, skied off with her foot on his ski, and her other foot is locked in the snowboard up, where the chairlift is. So tangle, 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 and off goes the ACL. But
disappointing is the word that popped into my head. Disappointing. Should just be going about a business, and that happens. And then we've got skiers versus snowboarders too.
Yeah, so
talk about.
and there's your ACL in the snowboarder, yeah. And the thing up there is the other injuries. So, those kissing lesions or tibial plateau fractures as well.
Hang on, let's define that one, kissing lesions.
You can do that.
You're the expert here.
I'm not an expert, but it's just where the bone meets the bone. So you can get like an impact fracture, non-displaced. So I think typically, and look, I might be wrong, but the ones that I saw were the lateral femoral condyle of the femur. And so not only do you have the ligamentous and the soft tissue injuries, but you've also got the bony injury in there. And that's why it's important with these particular ones that, you do get the MRI and you get a plan of how to rehab these and which way you're going to go. Are you going to go conservative? Are you going to go surgical? Always having sort of that orthopedic opinion, whether you're going to go down surgery or not. Can be quite helpful. And that's why getting the right people, depending on where people live, and you having a good list of people to refer to is really important.
So you're in the clinic mostly on your own as a physio, but then you talked about the importance of a network. Jane Rooney's a world expert in ACLs, and you can give Jane a call. Not everyone can do that, but that's why you build up a network, right? And you've got lots of resources online. You can get to know surgeons. So tell us a bit about that. So imagine you're a new grad again. You're working in that clinic. You feel isolated, but you've just talked about how important it is to involve the doctor if you think they're going to require an MRI and a follow-up, a surgical opinion. So how do you actually do that when you're working on your own in this building, but you need to involve other people?
I say it a lot with the thing that I like about, I'm going to put it in the realm of the skiing, snowboarding. So the thing that I like about it is working up in a ski field. No one works up there if they don't like it. If they don't like the cold and they don't like skiing, they don't like snowboarding, people don't go there for that. They won't put themselves in that position. So the people that are up there are all pretty the same minded. And even when I came to this clinic as an experienced physio, the amount of support given to me already when I came in from the previous physio that was there, he said, if you have any questions, just ring me up. I've got this, and this I can help. There are also different groups. So there's the Olympic Winter Institute of Australia, and there's the sports medicine chapter of that. I think Peter Kane, or Caney as most people know him, he's heavily involved, and I've been involved in that. And after this week, I'm thinking maybe I should rejoin. But so understanding that the mountain as well. So the people that work on the mountain. So there is a medical centre there. There is an X-ray facility. There isn't an MRI. They have to travel a couple of hours. Maybe I think Albury was the closest. But they're there to help you as well. The team down there, and I got to speak to them. So if you were feeling isolated, there's no reason why you can't talk to the people that own the clinic. They've seen it before. They'll know who to put you in contact with. But also you can wander down to the medical centre and say, oh, look, I'm in the physio. I'm up there. I was just wondering if I could say hello, talk to someone. I mean, I spoke to a couple of the doctors just in regards to some of the work cover stuff. And that gave me an opening. And then we just stayed online and chatted for ages about, where do we go with these ACLs. So previously you probably just put them in a Zimmer splint, waited for the knee extension splint, waited for an MRI, whereas now they're really trying to not avoid that terminal extension, so that lasts probably 20 degrees, in which case, when there was a suspected ACL, the medical centre would send them back up to the physio. So they'll put them in the Zimmer to be comfortable and protect them to get them up to us. And then we'd take the Zimmer off and put a range of movement restriction brace on, and limiting that, 0 to 20. But if they had the range 0 to 30, and then put it to, maximum 90 degrees flexion. And that to me was really a new thing. There is, and I might just pause it here because my battery will die. And I want to go through the cross-bracing method.
Well, we don't want to miss out on that, folks. Hang on, we're pausing. We're going to return to the story. All right, we're back. You're powered up, ready to go again. So we're talking about that acute management of someone with an ACL injury, and that how we've been going for 20 years. How things have changed over that time, those practice trends, and how you had to upskill a little bit to see lots of people with acute ACL injuries and fit those braces. So tell us a little bit more about that.
So I guess the thing that's emerging right now, I think there was a small study, case study, and there was about 16 fresh acute ACLs, and it's called the cross bracing method, where they aggressively braced the knee into 90 degrees, particularly for the first 4 weeks, and they can't move out of it, so they're sleeping in it 24 hours a day, obviously non-weight bearing, and it's really to try and encourage some healing, which previously thought would not be available to our own self-healing of the ACL. But they found, I think 14 out of 16 displayed some healing in that ACL at about 12 weeks. So I think the first four weeks, they're really aggressive with just you're locked in at that 90 degrees, and then they slowly come out of it. And now there is a study coming out of the Australian Institute of Sport where they're looking for these ACLs and trying to do a much larger cohort and seeing, is this feasible? But the only problem is having your knee at 90 degrees locked. You can't drive, so that can be a big issue. So you really got to pick your patients. But if this study, shows that this is something that is quite doable, and it does lead to good results, good outcomes. I mean, it can really change the world in management of ACLs and options. And look, if I did an ACL and that was an option and I knew I'd more than likely have a good outcome or potential, I'd go it. It does mean that you'd have to shift around your life for those, I think, up to 12 weeks, I think. So the first 4 weeks are more detrimental, but I think it would be really good. The other thing is there's one that's a bit less aggressive, and that's just putting him in that range of movement restriction brace and still limiting that extension. And I think it's up to 6 weeks, but you've got to keep that brace on. And that's where, you've got, I think, 30 to 90 degrees. And again, this is something that is evolving, and it'd be really nice to see where it goes. But without doing these sorts of experiences where you're putting yourself in these, new environments, you just don't learn. Like I find it almost impossible to stay up to date with all the research.
But if you're not reading for a reason, you're just reading it for the sake of knowing more about ACL management, it's far less interesting than if you're actually preparing for a week where you're going to see lots of people with ACL injury in the snow, right? Yeah,
exactly. And I mean, obviously ACLs aren't the only thing that I saw. And that's the nice thing about going into different clinics. So as a new grad, I mean, and for those that like to be in the sports and feel like they're not really getting anywhere, there's always opportunities for games. You and I did the Alice Springs Masters games initially, and that just the amount of knowledge, because you work in a polyclinic, so you've got top doctors, top physios, you're working all together, you learn a lot.
You must have put on 5 kilometres. What's that? 3 miles of tape on people in about a week. At that week up there, being the Masters Games, everyone's getting niggles and getting taped and getting treatment.
Exactly. And you learn not only, I mean, you show how you tape, because often these places are, maybe you're separated by a curtain, sometimes you're not, but there's always the opportunity of watching other physios, see how they tape. And how they might tape differently to you, etc. So that can be a big bonus. I mean, I worked at, in gymnastics for the Commonwealth Games when they were up in the Gold Coast, and learned a lot about injuries and how physios, what their role is. Or I can't really say game day, competition day, what you do. So that was interesting, understanding that the venue will have the physio and the doctor. So if there is an injury, it's up to the venue to get the medical to that athlete. And then when they're taken off behind the scenes, that's when the team doctor, team physio can come into play. So you've got different roles there. And like in the clinic that I was just at, you had a lot of the acute stuff. So even concussion, like there was a fair bit of concussion. So that's your other acute stuff. And then you've got the workers. So then you've got, the repetitive strain injuries and all of that sort of stuff. So you've got a whole range of presentations that, in your clinic, my 1 day a week, that I would not see. So it's really getting that experience up, and it gets your confidence up as well. I mean, I work as well with the AFLW, like the academy, so Australian Football League in the women's. I'm coming up to do another game with the Indigenous representative side. It's going to be a curtain raiser. I'm looking forward to it. But the thing that I like about it is I'm at that point now where I can, anything that I need to tape, I'm quite happy to tape. Like I have that many reserves and libraries in my head of how to tape, And
that's to the point though. That's all come from a lot of volunteer work and a lot of experience that you just said yes to, or just asked someone, I'd like to help out with that, or I'd like to be involved. Sure.
Exactly. And, just there's always places that you can do, like always events that you can do. Like I know there's university games, etc. So if you're really into the sport, like the volunteering, like I did that much volunteering initially. And the thing with volunteering is often that you're not the only one volunteering. So you will learn from other people. And, the other really nice one is, if you're in the city working, or even in the country working with, like your football teams as a trainer, coming through, if you're not confident, and then once you're confident, then you've got your physios and your doctors. So once you graduate and all of that sort of stuff. But if I could go back again as a student, that would be one of the things that I would do, is be a trainer for a football team. I mean, having said that, when I was at uni, the best job that I had was being an orderly, or a patient service attendant. I think that's what they are, PSA, in the hospital. So helping the nurses, helping, the run, if someone needs a blood test, you're the one that gets the blood test from the ward and takes it down to pathology, etc. But the thing that really helped me with that job is understand the layout of a hospital, and also understand sort of the nurses' role. And then when I went on clinical placement as a student, it was interesting looking at the other students that were on with me. They'd get a patient, they'd see them, and this is a classic story, I'll tell you, because I find it funny. I knew that the nurse would be with the patient all the time. The doctor comes in, does their thing, but that could have been an hour or 2 hours before, and they've written their notes. And they could have taken a turn for the worst, or, just something might have happened in there. So I'd always ask the nurse, is it all right if I get this person up? And they'd say, yeah, they're feeling fine and they're actually ready. Do you mind helping me take him, because they need a shower? And so then you can work as a team. This student that I was with, he just went to the notes, sort of, okay, I've got to get this guy up, and off he went.
Tunnel vision.
Didn't even tell the nurse that's what he was going to do. And I came in and she starts laughing. She goes, oh, look at this. Look at this. I've just given him an enema and he's feeling quite nauseous too. So he should not get him up.
Hang on. People are trying to eat their breakfast here.
Anyway,
I'm trying to keep Physio Foundations G-rated. I don't want to tick the little box that says explicit content because that's more work for me. Yeah.
But you can imagine what happened there. So it did not end well. And but it showed, that experience of you don't have to be a physio to get the experience, So for me, being a ski instructor really got me to understand the mechanics or the biomechanics of skiing and how to teach it, etc. But the teaching of skiing is very particular, and the way that you teach, you've got to give them the visual cues, you've got to give them the audio clues, you've got to give them feedback, you've got to give them time practicing. All of those points I then took to when I became a physio and doing the exercises and handing out exercises. I'd go through those points, and a lot of my colleagues would get frustrated that their patients weren't doing the exercises. Whereas I wasn't getting that because I'd give them all those opportunities and the feedback, etc. So I was quite confident that they knew how to do the exercises. And if they got it wrong, I was already there and correcting it. And also when they came back, they would tell me, whether they were doing it or not. And when they didn't do it, they said, they had the confidence to say, actually, I forgot how to do it. And they weren't too embarrassed because we'd actually spent some time. Some physios tend to go, okay, here's the exercises, off you go. Or just have a quick go at it. And then the prescription sometimes isn't there either because the physio is, okay, 3 times 10, and they'll just do a couple of the reps with them rather than actually seeing, okay, where do they fatigue? How?
Yeah, on that one, I don't know. We always hear that on social media, and it's a nice, convenient.
And I shouldn't say physio
to say about other people because you weren't there, right? That they did this and they did that. Who knows what was actually attempted? But I think you've hit the nail on the head there. It's not actually the number of reps here. You're giving someone a rehab exercise. You really need to be looking for the point of fatigue and coaching them through it and basing your prescription on what they can currently do and giving them progression. And that's potentially what's missing sometimes, rather than the idea that someone just gave someone 3 by 10. I don't know. Maybe they ended up there. It was the process, not the goal that was the problem.
And sometimes the 3 times 10 is perfect, especially when they first start out and, hey, pain is the issue. And all you want to do is get their confidence up and get them going. And as long as the pain's not getting worse, and then you're not necessarily so focused on your dosage, you'll focus more on them doing it. And then once they get past where pain is maybe not the biggest issue, is now let's focus on getting some of that muscle strength back, getting some endurance, power, whatever it is, then becoming more specific. So again, that's a different sort of presentation and prescription in that, those early phases, where you're just getting them confident with exercises that they're not going to necessarily flare up, etc. And you're just getting them to do it. And that the 3 times 10 isn't going to flare them up necessarily. So
there's an alternative take on that.
Yeah. So it depends on what stage you're at too. So, but yes.
Great. Lots of gold there.
But yes, so to wrap it up, I really enjoyed my time away. The other thing that I like about it, going away, is just the learning, but having that self-reflection. You don't have all the stimulus of home. So for me, it's a lot of family, obviously, and that sort of stuff. But even just being at home, you've got your partners, you've got your family, you've got all the, friends, and you always want to get out and go. Whereas when you go to these sorts of things on your own, you've got time to just reflect. And, if you want to stay behind and look up something in a textbook, you don't have, dinner's waiting for me and all that sort of stuff. So it's sort of your time. And I think that's the best sort of environment for learning as well, just having a step back. And I will just quickly say this, although it's not quick. I did go with a professional team overseas. It was in Utah, and it was again at a ski resort, even though the ski resort wasn't open yet. So they were just using the facilities and the high altitude. But the main goal for taking the players there, and it tended to be the younger ones coming through, was to get away from that environment, so that the pressures of the family and everyone around them,
Right.
To understand their own bodies, their own recoveries, and so that they could really look at what they needed. So they had the options of, all the massage, compression, ice baths, etc., so that they could figure out, okay, what are the 1%ers that my body needs? Because they would really put them through training. And then it was up to them. So it gave them, that was the thing. They said, if you want to be a professional, you now have to take charge of what you need to do. And you sort of don't, it's hard when you've got all these other pressures on the outside. So putting yourself in that.
And like you're saying, it's the same for a health professional. And the real reason for you going there was a well-deserved break from all the family responsibilities. You're doing your PhD full time, you're working in the clinic, and you go up there and just have a fresh look at everything. And also, how many runs did you get in? Do you think how many? Because that's the thing. You've sort of paid for your week away skiing. How much would that cost, do you think, to go for accommodation,
it's
lift
expensive.
tickets and everything? Yeah. So
but
it's sometimes a creative way of getting a holiday in as well.
Well, I had a number in my head. So I was lucky enough, let's just say $100 for the lift ticket is my discounted rate. So the real rate is much more expensive, but that was for the day. And I did that on a half day. And I thought, well, if I get 10 runs in, that's $10 a run. And I'm happy with that. But I'd be really happy if I did 20 runs, which is $5 per run. So that was my goal. And I achieved that, but at the expense of my thighs, my quadriceps, who were screaming. Yeah, they were screaming at me. They were going, come on. But having put myself through that, and that's the other thing that I like to do, is if you give exercises, make sure you've done the exercise yourself so that you know what it feels like.
Yes,
so when
please. Please just do. Yeah, don't prescribe exercises you've never done yourself.
So this
public service announcement.
So this was the same. So my thighs were on fire, and what we have is Game Ready, which is this compression sleeve, and then it puts ice water through it. So you're getting the ice plus the compression. And I've given it to people before, but I thought, I really should know what this feels like myself. And so that's what I did. And I must admit that it really did feel pretty good the next day. I thought I'd be a lot sorer, but that Game Ready, it was that ice compression was fantastic. So then, of course, that helps me when people come in and, they're quite sore. Oh, look, there's this option of this, intervention here.
Yeah, we're not talking about evidence. We're talking here about personal experience and the weighting you could give to that. Yeah. Hey, just a quick question. Have we found a cure for snowboarding yet? Oh, hang on. We'll cut that bit out later, won't we?
No.
Good one. No. Okay, so to finish off, you go on.
I was going to say, look, I think what you're getting more and more of now is a lot of people that do both. They do skiing and snowboarding, and I can tell you that I had a few snowboarders that did some injuries, and so they went back to skiing, and also the other way around. So,
shout out to all our friends around the world who snowboard. We still love you. Yeah. You don't love us anymore. Skiers, all the physio students listening to this, wherever you are. All the other health professional students, I know that we've called this Physio Foundations because that's our background, but anyone who's remotely interested in sports, therapy, any sort of athletic training, trainers, coaches, athletes, anyone who's listening to this who has a sports background or interest in skiing or other types of sports, good luck with everything that you do, and we hope that you find this helpful. So any final thoughts, Zuzana, before we wrap this thing up? Thanks for your contributions here. It was some gold in that episode.
I just hope people like our ramblings, and I'm sorry I do ramble on.
Podcasts are for rambling. It's a casual chat where you talk about experiences, you share ideas, and the whole idea is, like, your big theme of this episode has been the network. So the reason you were up there and you had that opportunity wasn't because you applied for a job, right? It was purely that big network that you've developed over the years and you've been working on, and you put effort into, like any friendships or family or network. You put effort into connecting with people and asking how they are and following up with them, and then opportunities come up and then you say yes to them.
And I must admit, yeah. So the best jobs are not advertised. Someone told me that. And one of the best tattoos I saw, just offhand here now, in my time in the clinic, was "Not all wanderers are lost."
Ah, yeah.
I liked that one. So, do wander the world. Luke and I, we've traveled the world. It's the experiences you get are so good. And you can even do it in your own country. We've worked in Adelaide, we've worked in Melbourne, we've worked up in Darwin, Brisbane, lots and lots of places. So I just find that just being where you are in the one spot tends to work in a particular way. And these opportunities where you can just go for a week or two and work in a clinic that's outside your realm, you'll just learn so much, not just there, but you can then bring that back to your clinic or wherever you work. And I for example, just quickly, my PhD application, I had to put in all my jobs, and I had over 20 jobs that I've done. So every little place you go, there's always something new, and it's exciting.
Well, we've got a traveling around the world theme here, which is something that it's one of the perks that you get from having a health professions degree. You can travel and your skills are transferable and highly sought after, and you can help people all around the world. So I just want to shout out to people all over the world who are listening to this. We've got people in countries all over Asia and America and Europe and New Zealand, Australia. So keep doing that good stuff that you do. If you're studying, it's a grind sometimes, but it's so worth it. Keep it up. Just keep going. Keep focusing on why you're doing this. And if you're working and if you do feel isolated in any way, listen to the messages Zuzana's giving you here. It can be an amazing career when you let go of the idea of this concept of having to know everything and being autonomous and I'm the center of everything, and just go out there and just talk to everybody and see where you can go. And also our regular listeners, shout out to you and thanks for your support of the podcast. Remember, everyone, you can help us out so much by just putting this on social media, put the link on there and sharing it with a friend. Podcasts are a real slow burn. They really don't get found out until you share them. Most of the growth of a podcast comes from listeners referring it to someone else. So that's what you can do if you want to help get these messages out to other people, and we can build a community. All right, let's leave it there, Zuzana. Thanks so much. Now I'm going to go back to the other room and we're going to go walk the dog.
On the beach. Different to the snow.
Now, I do appreciate you coming on and chatting to everyone. You've got so much to offer. So until next time, this is Zuzana and Luke wishing you all the very best with your studying, professional development and lifelong learning.